I have sat in a lot of rooms with clinicians who, quite frankly, fear that somehow this technology or this model is going to make them redundant or not necessary anymore. And I say it's exactly the opposite. Without the clinician involved and engaged in providing care to this patient, the box does nothing. The vital sign capture does nothing. The educational information doesn't really do anything. The point is that what remote patient management models do is it bridges a gap and connects the clinician to the patient. So nurses that are trying to manage a patient, this is a tool that allows them to do a better job. It connects them more tightly. It gives them more information so that they actually can target their education and target their support to exactly what the patient needs. It helps them identify patient needs that otherwise they would not necessarily be able to identify. Remote patient management models are tools and services that help the clinician be more efficient and more effective in what they do. And we've seen this when we've talked with clinicians, all the way to the fact that if I want to, I can have a video conferencing call with the patient where I can lay my eyes on them. I can see all the things they don't tell me, like their hair doesn't look like it's been washed, they look pale, they're not dressed and it's 2 o'clock in the afternoon. It tells me things that I wouldn't get if I was just on the phone. Remote patient management models really strengthen the relationship and make a closer bond and a tighter bond between the clinician and their patients in their homes.